Hey y'all, it's a nice day here in Northwest Arkansas, a little cloudy. Just going to wrap up this community health assessment plan and presentation. Had a good semester, and I wish everybody luck as they continue through this program. Wish them success. So I live in a tourist town in Northwest Arkansas. It's called Eureka Springs. It's full of natural Ozark beauty, and we get about 750,000 visitors each year, and about 2,500 people support this with the tourist economy. So our main industry is food service industry, entertainment and accommodation, makes up about 32% of the workforce. Problems with this is oftentimes individuals in this industry do not get health insurance, and there's also high levels of drug and alcohol addiction. So the purpose of my community project was to spread awareness of basic coping skills and mental health care resources available to community members who maybe do not have insurance. My definition of a community was community can be defined as a collection of people who interact with each other, share common interests, and share a sense of belonging. And there I'd paraphrase what Eureka is about to many of the individuals. We have a lot of artists and musicians here, a lot of diverse populations, LGBT, just a lot of interesting people. And Eureka is very welcoming to everyone, and honestly has a lot of infrastructure to help support marginalized people. Put a little picture of one of my favorite shows down here, Community. Enjoy this windshield survey. So Eureka Springs came to be in the 1800s when a blind prince from Europe came and bathed in what is now known as magnetic springs. He claimed that his blindness was healed. And so after that, a lot of wealthy royalty and European people came to Eureka Springs and developed this sort of interesting town with lots of Victorian style homes and architecture. And a lot of people call it Little Switzerland for that reason. Basically town full of businesses to support the tourist industry. Great nightlife. What I really enjoy is Lake Leatherwood, which we call it our city park, but really it looks like a state park with all the hiking trails and natural beauty that's associated with it. And we do have, for a town of 2,500 people, we have 3 primary care offices, a hospital with ER. One of the primary care offices that I've really focused on through this presentation is Boston Mountain Clinic that just opened up at the end of 2022. I'm glad it did because it has a sliding scale financial fee. And so individuals without health insurance or who maybe are low income are able to get primary care, psychiatric care, and mental health counseling for as low as $10 a visit. So I really wanted to spread awareness of that throughout my project. There's some things I've talked about already. Of course, the food service industry, unfortunately, has the 3rd highest rate of suicide of any profession, as well as the highest levels of drug and alcohol use. And about 20% of the population here is uninsured. And I have hypothesized that just through, my own personal experience, that many people who are uninsured do not seek preventative care just because they don't think they can pay for it. So they only get care for ER visits, I would hypothesize. Community partners and resources. I initially wanted to do this at a local coffee shop where I thought might get a little bit more traction. But I went with made a Facebook post and see who would be interested in helping me. And Seth Barker is a guy that works at a local health food store and is also a life coach for 5 years, reached out and said that I could do my presentation at his weekly personal and spiritual growth group meeting. It's at a place called Heart of Many Ways. It's a cool building, cool place. They have everything from Jewish meetings to meetings on Ram Dass, meditation meetings, sound healing. It's basically a place for spiritual groups to gather and demonstrate unity beyond religious ideals. A lot of good things happening there. It's an old building that they're also trying to restore, keep going. Over 100 years old. It started off as a Christian Science church. 3 community resources that I use for my project are, one is the Purple Flower, which is a It's a resource for victims and families of domestic violence. It's a place they can go live, get career counseling, and just get individual counseling as well to work through that trauma. The Eureka Springs United Methodist Church, which is the church that I attend, they do offer several resources, include supporting Flint Street Food Bank. They also support Echo Clinic, which is now in works with Boston Mountain Clinic financially. And then the Eureka Springs Community Center, which opened up 3 or 4 years ago and has just been a great resource for the community. Of course, any age can go there, but elderly and the gerontology senior citizen populations, it provides a great place for them to socialize, keep their brains active. And it's, like $90 a year. So very affordable for people on a limited income. Community health diagnosis, pretty straightforward. Knowledge deficit of basic coping skills and mental health treatment options available among the adults of Eureka Springs, Arkansas, as evidenced by the high levels of alcohol and drug use in Eureka Springs, Arkansas, in March of 2023. So, I'm 30 years old. I have been a professional fiddler for 20 years. And so it's always not the best lifestyle and community associated with musicians. And lots of nightlife. And so a lot of times you talk about basic coping skills and they say, what is that? So I thought that would be something that I could share some information on. Also just talk about counseling. My plan to initiate this was to advertise on Facebook, to raise awareness and promote the event, increase awareness and positive coping skills, just kind of talk about what will happen when you seek that mental health care. I know it can be scary at first because you just don't know what the process is. And so I wanted to kind of educate on that, and then also talk about Boston Mountain Clinic's sliding scale fee, which makes it pretty well affordable for everybody to get that primary care visits or to get mental health counseling or psychiatric care. I made a trifold brochure, as you can see on, I guess, my left, or maybe on your right. Have to think about that one. I'm not a great with technology, so I had to figure out how to do a PowerPoint. And my initial thought was to do it on a projector, kind of like you see in college or at work. But then I thought, well, I bet I can connect it to my girlfriend's smart TV. So I figured that out. And honestly, it was a very easy process. If anybody ever has to do that again, you can just you have to connect to the same Wi-Fi and then go to screen mirroring. It pops right up there. Very easy. I've been active in jiu-jitsu for 3 years. And so for me, that really helped heal 2 traumas that I had. It just helped me get my body, and then just kind of develop a community with healthy men. And so I wanted to talk about that as well as yoga. Thought that might appeal, yoga might appeal more to ladies and martial arts might appeal more to men. Just have, and both of those have documented research success on treating PTSD. The main success of my program was not the people that showed up, but just the one-on-one conversations that stemmed from my Facebook post. I probably had 25 people talk to me about their mental health concerns and what they might ask questions about, what they might do to help resolve those. And so I considered that a main success. I thought maybe people might not feel comfortable talking about those issues in a group. Only had 4 people come to my meeting, but it was a beautiful day. And so I thought that might be one of the reasons why. But I was real happy with how many people had one-on-one conversations with me through this process. It stemmed from my Facebook post. Evaluation. I thought the project was a success. I enjoyed meeting with members of the community. Got to meet with my psychiatric mental health nurse practitioner mentor, Heather, who works at Boston Mountain. She really helped me out a lot through this process, and so that was nice. Also got to talk to a social worker who is also a sensei at our local martial arts studio, and so I had some great conversations. So I learned some things, and hopefully some members of the community learned some things. conclusion, I do believe that this community health project did increase some awareness of affordable mental health care resources available, and did just, started a conversation for a lot of people, which might get the ball rolling for them. And here's my references. Thanks, everybody. Once again, hope you all have a good spring break, and I wish you luck on whatever you have left in your schooling. And thanks to the teachers that helped walk us through this process. Take care now.